As the Omicron variant rapidly spreads across the globe, researchers in the U.S. suggest the strain is more contagious than Delta. In a government-backed study out of Columbia University, scientists say Omicron is 36.5% more transmissible than the Delta variant. At least 47 states have detected Omicron cases. Earlier today, Dr. Anthony Fauci joined CBS Mornings, where he spoke about how to protect yourself.
This virus is extremely good at transmitting from person to person, but vaccination and boosting clearly is the answer to protecting yourself from infection, but even if you do get infected, protecting yourself from severe disease.
John Moore joins me now from New York City. He is a professor of microbiology and immunology at Weill Cornell Medical College. Thank you so much for joining us. John, President Biden says that families that are vaccinated shouldn't worry about holiday plans being impacted. But Omicron has led to an increase in breakthrough infections. So if a vaccinated person in your household tests positive for the virus, asking for a friend, how should families navigate these circumstances? If somebody tests positive and is showing symptoms, but no one else in the household is testing positive or showing symptoms, can you meet with the other members in the household? I'm not sure how this virus works, particularly this particular strain. What would you recommend?
I wouldn't mix with someone who's tested positive because they are very capable of transmitting it to the other family members. It's a very transmissible virus, and we're seeing a lot of breakthrough infections even in vaccinated people. We're seeing more of them, of course, in unvaccinated people, which is another issue entirely. But you can transmit that variant very easily to a family member, so I would not mix with someone who has tested positive. Simple as that.
What about somebody who has been in contact with someone who tested positive, but has not tested positive themselves? In other words, they live in the household where someone has tested positive, but they haven't tested positive. And you're coming from outside of the household to celebrate the holidays. Would it be safe to interact with that person if you're fully vaccinated, or should you give it some time?
Well, you know, these circumstances are very difficult to navigate because it depends on what you mean by contact somebody else. I mean, there's no simple answer to these things. The Omicron variant, as you reported, is more transmissible than the one we've been used to, which was Delta, which was more transmissible than what was around earlier this year, which was Alpha. So we're seeing this increase in transmission. So there's always an increase in risk of getting infected. And so people are being advised quite reasonably to rely on testing. Well, PCR testing, if you can get access, is very reliable and very sensitive. But people can't get access to it. There's just lines around the block at the testing sites. The rapid antigen tests, which are going to be distributed more and more of them, they're not as sensitive. So there are plenty of examples of people having a rapid antigen test and coming across as negative, but the next day or even later that same day you can become positive. So there's always risk here, and there's not much you can do about it. You have to have an acceptance and a tolerance of risk and an understanding of whether or not you consider it worthwhile. I mean, as of now, my family will meet on Christmas period. There'll be 6 of us. We're all fully vaccinated. We're all with no symptoms at the moment. We'll all monitor what's going on, but we intend to meet as a 6-member family group over Christmas. And we think that's a manageable risk. If that changes, we'll adjust accordingly.
I'm so glad that you sort of expressed it in that way. I remember hearing another expert talk about a risk budget, that you have to kind of determine how much of your risk budget do you want to spend. You know, is there anyone in your family who's not vaccinated? Is there anyone in your family who's fully vaccinated but has an underlying health condition? And you have to kind of determine for yourself, is this particular event worth the risk or not? So I think you're sort of really defining it well. I want to ask you about the need to be tested. The president said that the administration is ramping up their test plan. They're going to be making at-home rapid tests available for free widely. I want to get a sense of what you make of those tests. And also, you know, when we were talking this morning, one of our producers kind of said, you know, one of the issues with these tests is sometimes people, they test positive and then they just stay home, but they never ever report it. So I'm wondering if, you know, testing is great, but it really has to go with reporting as well. What's your take on that?
Well, it's unrealistic for individuals to report their positive tests. If they're doing an at-home test, I don't expect them to phone the CDC or the local health authorities and say, I've just tested positive. I mean, that's just not going to happen. Look, the issue with the tests is, firstly, the FDA is currently evaluating all the rapid antigen tests on the market, and some of them are probably not very good. The Europeans have just released yesterday a survey of European tests, and some of them I wouldn't rely on. I don't think they're being sold in the States, but the FDA is conducting a widespread survey, and I expect the results to be, you know, out this week sometime. But even for the most reliable tests, they're not as sensitive as PCR. PCR will pick up an infection earlier than a rapid antigen test. Now, if everyone had access to PCR tests, that would be great. But they're in shorter supply, and you can only get them in specialist testing facilities. They're not at home generally. So we can only work with what we've got. The Brits are finding this. They use lateral flow tests, which is a form of rapid antigen, and they're just having the same problem. They're not as sensitive. They're not picking up infections as early as you would hope. But here we are. What are our choices? We use what we've got. We make the best possible decisions. You know, and as to your point about risk management, look, I'm the oldest member of our family group. I'm in pretty good health. I don't have any particular fears of what could happen over Christmas. But if I had, if my mother, who's obviously 20 or 30 years older than I am, was with us, she would be at greater risk because she's older and frailer and more vulnerable. And anyone who's unvaccinated would be at much greater risk. So I'm really fearful for the unvaccinated. I mean, the unvaccinated, they're already dying. We're already losing 1,300 Americans a day, and 90% of them, or 95% of them, are unvaccinated. So if I was an unvaccinated family, I would be checking that I knew the address of my local funeral director, because some of them are going to need it over the winter. We could lose another 100 to 150,000 people over the next month, and it's all down to this disinformation about vaccination that's being spread on social media and right-wing political networks. I mean, politically motivated Fox News, QAnon, OAN-type news networks. It's the root of our problems. It's we're losing so many unvaccinated people completely unnecessarily.
You know, I totally agree with you. The people that I know who have tested positive for COVID recently have all already been vaccinated. And so it makes me, just like you, very scared for those who haven't been, or those who got one dose and didn't bother to follow up. The boosters are available. Everything is available for you to protect your health and protect the health of others. You know, it's sort of like a little bit less than 30% of American adults who have not been vaccinated. And, you know, to your point, these are the people who have already seen all the public service announcements. They've watched their various sports heroes get, you know, inoculated on camera. They're not budging. What do you think needs to be done to encourage these last holdouts to get vaccinated?
We're past the point. I think we're past the point of encouragement. It's mandates or nothing. People have to be given choices between restrictions of their lives or getting vaccinated. And it comes down to information sources. I mean, do unvaccinated people watch public service announcements? I doubt it. They get their news from the talking heads on Fox News, on social media, their granny's Facebook feed, all sorts of reliable information sources. And now there's a major risk factor for developing severe COVID and dying, and that is voting Republican. There's about a 5-fold risk of dying of COVID if you're in a high Republican voting county compared to in a high Democrat voting county. Now that's on a par with the risk of getting older or being obese and have underlying health conditions. It's an amazing phenomenon, the political segregation of dying And that reflects the influence of right-wing media and right-wing politicians who emphasize this personal choice thing over the choice between life and death. I mean, this concept of live free or die is becoming live free and die. And it's an amazing phenomenon in American life nowadays.
John Moore, I'll have to double check a little bit what you say, but I know that there have been studies that sort of indicate that. But what I will say, sort of at the center of it, because I know there are Republicans out there who are double vaxxed and boosted and believe in vaccines, that you were very right that the misinformation that is prevalent and rampant is at the core of it, and at times there are members of mainstream media or prominent people who reinforce or sort of give a nod to this misinformation, and the result is that people are dying and people will continue to die. John Moore, pleasure talking to you. Thank you.
Thank you.